And of course, it has to be a wide QRS complex greater than 0.12 to fit the criteria, but these are your normal morphologies in a left bundle. So here's another example of that. So again, if we look at V1, which is really the only lead that you need, if we zoomed up and assumed that these QRS complexes are greater than 0.12 seconds, we can see that the terminal forces are ascending back to baseline here in V1, which is a left bundle. And if we look at V6, they're descending back to baseline. And again, this is a common morphology with a left bundle branch block where you see some ST elevation changes and you see some ST depression changes in your lateral leads. That's very common in a left bundle branch block. And again, SA node still firing, but when you get down to the left bundle, there's a block in there somewhere, and that's what causes this. So here's another good example of a left bundle branch block. Especially if you look at V1, you can see there's this ST elevation, which we'll talk more about later, but there's 2 or 3 millimeters of ST elevation, and that's normal in a left bundle branch block. It's very common. But if you look at the terminal forces of this QRS complex, they are ascending back to baseline, which is hallmark for left bundle branch block.
First chapter free at practicalems.com.